The CDC's new language regarding vaccines and autism. Joining us is Medical Correspondent Dr. Darien Sutton. Thanks for being with us this morning.
Good morning.
So let's start with Health and Human Services Director Robert F. Kennedy Jr. He says he asked the CDC to update its language on vaccines and autism. So tell us, what exactly changed?
Well, a significant change to the CDC website regarding vaccine safety. So essentially on the website, there's a statement that says the claim, quote, vaccines do not cause autism, end quote, is not an evidence-based claim because studies have not ruled out the possibility that infant vaccines cause autism. Now, Janae, aside from the fact that there is a substantial amount of evidence that shows that there is no link between vaccines and autism, this statement is significant from the CDC, Premier Health Institute, leading a lot of public opinion, and it's a statement that is not based in evidence. There's no new study that shows any association between vaccines and autism. And Janae, in practice, over 5 million participants, that's how large these studies are, show continuously over 40 different states that there is no association between vaccines and autism, and it's not consistent with our current reality. We're seeing a decrease in vaccination rates and a rise in the diagnosis of autism. Last year, half the states in the United States saw a decline in vaccination rates compared to the year prior.
Do you think it'd be fair to characterize that statement from many medical professionals as alarming?
It is alarming and it's concerning because it's shifting moms and dads who are trying to make this difficult decision and adding unnecessary fear. And it's so important for parents to understand that when you're looking at these options, the risk of an infection and complications far exceed the risk of vaccines that we use to prevent them. And your risk of exposure to these diseases, Janae, is almost certain. For example, this year we saw 45 outbreaks of measles at least. That's triple the number we saw last year. We're seeing rising rates in the country. 90% over 90% are unvaccinated, and these come with complications. Before vaccines were available, close to 50,000 people were hospitalized in this country secondary to measles.
Okay, so for you, you're saying that's the bottom line that parents need to know right now when it comes to that. Okay, let's also talk about another headline that we were talking about this week. The March of Dimes released its annual report card on infant mortality. You were here on GMA when I reported this, giving the U.S. a D+ for the 4th year in a row. What does this grade tell us about the state of maternal and infant health?
It tells us that women, mothers, are in dire need of quality obstetric care within this country. 1 in 10 infants born premature. The studies are staggering. For Black mothers, they carry and continue to carry the burden of these numbers. Black women 1.5 times more likely to have a premature baby, dying 2 to 3 times at a higher rate compared to their white counterparts. So important to understand these variable rates are different from state to state, likely secondary to policy. But for moms trying to look for assistance out there, know your numbers, your blood pressure, your blood sugar, seek out assistance early and make a plan now if you're deciding to have a family, because unfortunately these systems and policies will take time to shift to help mothers in need.
It blew me away that nearly 25% of moms are not getting the care they need during their first trimester. Dr. Sutton, thank you so much.